Hey everybody, Tim Wyatt, clinical specialist. Thanks for joining us today. We are going to do another video on liposuction fibrosis, post-liposuction, specifically Lipo360 today, because this is by far one of the most popular topics going on right now and probably the #1 inquiry that we're getting after plastic surgery, which is, I'm having liposuction, I'm having a tummy tuck, I'm preparing for this, what do I do? How do I prevent complications, even worse? I've already had the surgery and I have complications, so what do I need to know and what do I do afterwards? So let's talk about a specific patient of ours that we've recently treated very successfully, who was probably what most people who have liposuction are patients who may or may not have had a tummy tuck, either a mini or a full tummy tuck, or did not have that at all and just went with liposuction by itself for the sake of removing fat, getting a flatter stomach. And then unfortunately afterwards something happens that creates the exact opposite, which is a lumpy and bumpy tummy or adhesions or scarring or other problems, okay? So let's pop up our patient right here. This is our recent patient, Jennifer, who we saw for Aspen After Surgery Liposuction Fibrosis treatment. And as you can see here in the before picture on the left, her main issue was that she had Lipo360. She had pain, discomfort, and swelling after the procedure, and she sought out some solutions on how to fix and address that. So Jennifer's first thing that she did was seeking out a type of sort of aggressive massage, because this is very popular. You're going to see this all over the internet and social media, of these very aggressive massages in which they use these kitchen utensils and these tools, even worse, some very aggressive type of therapy in which they're actually popping open incisions, draining out fluid, which is extremely traumatic, instead of getting the appropriate type of treatment post-surgery, which should emphasize lymphatic drainage, compression garments, as well as typical post-op, documented types of medical procedures afterwards versus these aggressive sort of type of treatments. So unfortunately for Jennifer, what happened here is you can see originally under her incision line here, she got a lot of swelling, a lot of inflammation. It almost creates like a muffin top type appearance above her incision that is triggered by the liposuction producing inflammation, then creating this almost balloon-like appearance against the incision line. So what exactly is going on with that? Well, as you can see on her incision here, that kind of balloon-like top is a function of the water building, aka inflammation, and it's getting hung up on her incision line. So what has to be done is getting the inflammation down, which is where Jennifer, after kind of pursuing other types of massages, which were not lymphatic drainage, finally did lymphatic drainage, and that helped improve things. The problem is in that process, she developed liposuction fibrosis, which is basically scar tissue or lumps or knots that begin to form after liposuction is done. So Jennifer came to us. She had already been in the stage of fibrosis. There was still some inflammation there. You can see here on the before picture. And we treated her using the Aspen After Surgery technology, the hands-on techniques, the appropriate types of tools. And you can see here on the picture on the right that the inflammation has come down. You can see that that muffin top-like appearance above her incision line is significantly reduced, but more importantly, that kind of lumpy, bumpy, cottage cheesy look that she had in the before picture is now smoothed out and better, because not only did part of the process of what our treatment is trying to accomplish is reducing the inflammation, getting mobility, but reducing those lumps and knots and that fibrosis here, which is how you can see that much smoother appearance that she has after that. So details for Jennifer's care is that she did about 30 days of the Aspen treatment. I believe she did 11 total treatments altogether, and besides coming in to receive our treatment, was given education, tools, information at home, products to use. And when we collectively put that all together, that is where we start to see results like Jennifer got, and an overall improvement that she did not see with the aggressive tool therapy or the aggressive massage type of therapy. which unfortunately could have contributed to worsening after surgery, but more importantly, kind of distracted from the real treatment after therapy, which should have focused on manual lymph drainage. So let me go over that again. I've said this in previous videos. If you're new to the channel or you're new to this video, the most important thing to understand in preparation after any surgery is pre-scheduling the appropriate type of treatment, which specifically for liposuction fibrosis and tummy tucks, whether it's a full tummy tuck or whether it's a mini tummy tuck, it doesn't really matter, is pre-scheduling with a licensed lymphatic drainage therapist. And why is that so important? Because doing appropriate lymphatic drainage keeps and reduces the likelihood of getting the muffin top, of getting the lumpy and bumpy, and getting into a position that is the complete opposite of what you're trying to do with the liposuction or tummy tuck that you paid for. This is important because we're trying to prevent a potential complication from happening, but more importantly, if you do have lymphatic drainage and you still build liposuction fibrosis, it happens. Sometimes the body just builds more scar tissue than you can break down. It is time to stop the manual lymphatic drainage, and you have to go to plan B, which is actually breaking down the fibrosis. Now, I'm going to say this with lots of emphasis. We're going to put this in a box right here because I cannot express this enough. If, God forbid, you do develop liposuction fibrosis, so those lumpy knots and bumps and contour irregularity, lymphatic drainage will not treat that. Lymphatic drainage is meant to prevent that. But once it develops, it is time to go to plan B, which is treatment that breaks down that fibrosis, and that's where the Aspen After Surgery Center comes in. So this is where we use our proprietary technology, treatment techniques that we employ, certain machines, devices, hands-on, that collectively all breaks down that lumpy and bumpy, because if you were to continue lymphatic drainage, it's too late. You've already achieved the level that you need to move to a plan B in order to break that down, okay? Other important factors that we discussed during treatment is your compression garment correct? There's a lot of mis and disinformation in the community regarding, my doctor said wear this, white binder with the Velcro on it and that'll prevent it. Nope, those are actually terrible. Those are glorified tourniquets that create more problems. We do not encourage those to wear at all, specifically to tummy tucks and preventing liposuction fibrosis. Your garment may be the wrong size. If it's too big, it'll create problems. If it's too small, it'll create problems. So that's another thing that we go over in the course of treatment is what is the right type of garment? Is it the right size? Bring it in, let us take a look at it so that we can say, well, you may need another one, or more importantly, you may have outgrown or outsized this one. It's now time to get fitted for a second or even a third garment that is a different size than your original one, okay? So anybody who has any questions, if you're looking at this and you're like, wow, I look just like Jennifer. I have the muffin top, the lumpy, the bumpy. I've got this cottage cheesy sort of like, bumps underneath my skin after liposuction or tummy tucks. Give us a call. Look at the 877 number below. Send us a DM, message us, whatever it is. We'd be happy to speak to you. Don't forget, no matter where you are in the world, we can do virtual consultations from anywhere. So if you have questions regarding, excuse me, can I get treatment? Where do I get treatment? How much is the treatment? What is the treatment all about? Reach out to us, connect with us. And lastly, time is of the essence. So anybody watching this is not something that you want to wait on. Liposuction fibrosis can get worse over time, and the worse that it becomes, think of it like concrete. Once the concrete sets, it's real hard to break up, but while it's still smooth and soft and wet, we kind of mold it and shape it. If you're considering doing the Aspen After Surgery non-surgical treatment, it is very important that A, we get a proper diagnosis that we can do by virtual first, but B, get the treatment right away, because the longer you wait, the less likely you are of getting the best outcome with the treatment. So, Tim Wyatt, clinical specialist. We'll catch you in the next video.